Right. Welcome all of you as you are joining our webinar. We're going to get started in just a minute. We'll just take a little bit of time to allow everyone to roll in here. So thank you for joining us this afternoon or morning, depending upon where you're at. Okay, we have a lot to discuss today, and I'm sure we'll still have others joining the webinar, but we're going to go ahead and get started. I believe that we are recording. So hello, everyone. My name is Kalia Souza, and I am the Food System Equity and Advocacy Specialist for Michigan State University Center for Regional Food Systems. Our center convenes the National Work Group Racial Equity in the Food System, or REFS, a community of cooperative extension professionals and community stakeholders who connect, learn, and collaborate to facilitate change within our institutions and society to build racial equity within the food system. As we're getting started, please take a second to let us know who you are in the chat box and where you're joining us from. Today's webinar is the first in a three-part series focused on building more equitable SNAP-Ed collaborations among land-grant universities and state and community partners. Our first session is going to focus on the SNAP-Ed federal funding equation and how state allocation decisions can inform and impact collaboration among stakeholders, as well as opportunities to advocate and organize for more equitable participation and collaboration in SNAP-Ed. And overall, just to note, this series is the result of a year-long process REFS has engaged in to identify challenges across the land-grant university system and opportunities for deeper relationship building at the intersection of racial equity and food systems. And its development has evolved through discussions with more stakeholders than I can name right now, and it's the better for it. We're honing this series in on the need to mobilize a collective vision for SNAP-Ed that is built on an understanding of the opportunities to strengthen equity in programming and partnerships. Through this series, you will hear from representatives across the land-grant university system, federal agencies, state and community-based implementing agencies, and nutrition education partners to help inform that action. And before we get to presentations, I have a few housekeeping items to share with you all. This session will be recorded and all materials will be shared with registrants in a follow-up email within a week of this webinar. We have time set aside for audience questions at the end of our panel presentations. So I encourage you to ask your questions in the Q&A box, not the chat. Our panelists may answer some of your questions directly there, and we'll answer some of your questions live. So next up, we have a poll question to find out a little more about you all. Next slide, please. Okay, so which statements describe your relationship to nutrition education programming? You're going to be able to mark multiple responses, so please mark all that apply. We'll give you guys just a little bit of time to respond to that question. Multiple responses, welcome. Okay, responses are coming in fast. Got a little bit more than half of all participants that have responded so far. Okay, almost there. Let's just give it a little bit more time. Again, multiple responses are welcome. Mark all that apply. And if you're someone that marked other, you're also welcome to indicate in the chat box what you mean when you say other. Let's go ahead and stop that poll and put our results up on the screen. Okay, so it looks like we've got an even split between my organization or institution is a state agency that administers SNAP Ed funding and or provides nutrition education. And I work at a 1862 land grant university that is a SNAP Ed implementing agency. Next, it looks like my organization or institution is not currently a SNAP Ed state agency or implementing agency. And then also that came in at about 1/5 of all answers. And then 1/10, I work for an organization or institution that is not a university, but is a SNAP Ed implementing agency. All right, thank you for those poll results. Thank you for participating in that. And we have some responses coming in through the chat box too. So, please take a moment to see what those who indicated other are mentioning. So at this point, I am going to introduce our speakers. Yes, thank you for going on the next slide. Doris Chin is a nutritionist at the Nutrition Education Branch, Program Administration and Nutrition Division of the Supplemental Nutrition Assistance Program, or SNAP, at the USDA Food and Nutrition Service National Office. Doris previously served as FNS's Mid-Atlantic Regional Coordinator for SNAP Ed. Doris holds a bachelor's degree in biology from the University of Pennsylvania and a Master of Public Health and Nutrition from the University of North Carolina, Chapel Hill. She's been a registered dietitian for over 35 years, and Doris started her career as a WIC nutritionist and has since worked in the public and private sectors and in academia at home and abroad. Dr. Marcy Scott is the Vice President of Programs at Michigan Fitness Foundation, where she leads multiple initiatives in the nutrition, food system, physical activity, and active community spaces. Marcy trained at Michigan State University and Emory University and is a registered dietitian nutritionist. She's held elected leadership positions in the Society of Nutrition Education and Behavior, the Association of SNAP Nutrition Education Administrators, or ASNA, and served 3 terms on a local public board of education. Marcy has worked in both public health and academic realms. The nonprofit, non-governmental organization sector is where she's settled with hope of making contributions that serve to change systems that perpetuate disparity. Erin Parker is the executive director of the Indigenous Food and Agriculture Initiative, or IFAI, at the University of Arkansas School of Law. Erin has worked in Indian country for all of her career as a food and agricultural lawyer, with the past 9 years at IFAI. She's worked closely with the board of the National Association of Food Distribution Programs on Indian reservations, and in her prior role as IFAI's research director, helped to institute a tribal leaders consultation working group at USDA. Previously, she worked as a staff attorney and research coordinator for the Equitable Commission, a national working group convened by the Secretary of the Interior to repair the federal government's Indian Land Trust Management System. In addition to her leadership at IFAI, she teaches courses in the University of Arkansas's Masters in Agriculture and Food Law, LLM program, including federal nutrition law and policy and indigenous food and agricultural law. Susan B. Forster studied at UC Berkeley in dietetics and public health. Sue's early career started by leading nutrition in one site of Boston's maternal and infant care, children and youth project. During her 40 years with the California Department of Public Health, she worked in chronic disease prevention and represented California with the Association of State Public Health Nutritionists. She's best known for her work on the California 5-A-Day for Better Health campaign and the Network for a Healthy California. One resulted in the National 5-A-Day program, a public-private partnership between the produce industry, the National Cancer Institute, and the Centers for Disease Control and Prevention. The network helped lay the social, marketing, and public health foundations at USDA for today's SNAP Ed. And since her retirement, Sue's remained an active volunteer with ASNA, especially in policy advocacy and evaluation. So with that, I'll ask that we advance to the next slide, and I'm going to hand things over to Doris.
Thank you, Kalia. Good afternoon and good morning, everyone. Thank you for inviting me to this important webinar on building more equitable SNAP Ed collaborations. This has certainly been a momentous year for SNAP Ed. We now have our own branch, the Nutrition Education branch, in the Program Administration and Nutrition Division. This highlights the importance of nutrition in the SNAP program. Our staff capacity has tripled in the national office and will increase our ability to provide training and technical assistance to the regional operations and to SNAP-Ed providers, and increase our capacity to collaborate with internal and external partners and organizations. We celebrated SNAP-Ed's 30th anniversary in the fiscal year 2022, which just ended. Our theme was celebrating 30 years of SNAP-Ed, educating communities, promoting nutrition security. Next slide, please. I hope you were able to join the White House Conference on Hunger, Nutrition, and Health last week, or have a chance to review the national strategy that was released with the conference. It was truly historic, being the second such conference in over 50 years. Here are the 5 pillars in the national strategy. 1, improve food access and affordability. 2, integrate nutrition and health. And 3, empower all consumers to make and have access to healthy choices. 4, support physical activity for all. And 5, enhance nutrition and food security research. For your reference, here are links to the resources developed for the White House Conference. It will probably take the entire hour and a half to just recap the rich discussions during the White House Conference. So we'll have to save that for another time and focus today on priorities in the USDA related to SNAP-Ed. Next slide, please. Nutrition security. As you know, nutrition security is a priority for this administration. Nutrition security means all Americans have consistent access to the safe, healthy, affordable foods essential to optimal health and well-being. Nutrition security builds on food security by focusing on how the quality of our diets can help reduce diet-related diseases. It also emphasizes equity and tackling long-standing health disparities. Next slide, please. To guide this effort, Secretary Vilsack introduced 4 pillars to complement the work we do in the USDA. These 4 pillars' names are slightly different from the 5 pillars mentioned in the White House Conference, but they're complementary. They are meaningful support, providing nutrition support throughout all stages of life, healthy food, connecting all Americans to healthy, safe, affordable food sources, collaborative action, developing, translating, and enacting nutrition science through partnership, and equitable systems, prioritizing equity every step of the way. These 4 pillars are already well integrated into SNAP-Ed. SNAP-Ed provides meaningful support by teaching food resource management and showing participants how to make healthy choices. Next slide, please. Our program based on the social ecological model. As you can see, the interconnections between the different sectors here. Policy systems and environmental change, or PSE interventions, help improve healthy food access in many communities, making healthier choice the easier choice. We continue to emphasize collaborative efforts in our programs so that our grantees can leverage the resources and expertise of partner organizations and avoid duplication of effort. In fiscal year 2021, state SNAP-Ed programs worked with more than 33,000 partners nationwide, and 87% of these partnerships included some form of PSE activities. SNAP-Ed has evolved from primarily direct education to comprehensive multi-level community and public health approaches. Our focus is to increase our PSE activities to expand program reach and effectiveness. SNAP started in 1992 across 7 states and has grown to include all 50 states, the District of Columbia, Virgin Islands, and Guam. We have a network of over 160 implementing agencies that leverage over 33,000 community partnerships to deliver the program. Today, I'm here to discuss equitable SNAP-Ed collaborations. So here are some recent developments. Next slide, please. Tribal consultations has always been required for SNAP plans of operations. FNS recently released a memorandum on tribal consultation requirements to further clarify these requirements. This memo, which was developed with the input of tribes and tribal organizations, spells out expectations for the USDA, requirements for SNAP-Ed state plan consultations, FNS expectations for SNAP state agencies, record keeping, requirement for conducting SNAP-Ed consultation and needs assessments, and requirements for conducting a tribal consultation for SNAP employment and training, or SNAP ENT. This document can be accessed in the link provided here, and there will be trainings related to this memo. So please stay tuned. By statute, FNS annually estimates the SNAP-Ed allocation to assist with preparing state SNAP-Ed plans. These projections incorporate estimates from SNAP participation and the Consumer Price Index. The SNAP-Ed final rule outlines the SNAP-Ed funding formula, which is 50% based on the state's fiscal year 2009 SNAP-Ed expenditures, and 50% based on the state's share of the national SNAP participation or participants for the previous 12-month period ending January 31st. This rule provides grants to state SNAP agencies through federal funding authorized especially for the SNAP-Ed grants, requires no state contribution or match, and is the only source for federal SNAP funds for these activities. Also, by statute, the state SNAP-Ed plans must be based on needs assessment. State agencies are critical to carrying out the needs assessment and using it to inform program decisions, such as equitable funding distribution to meet the needs of our priority populations, especially communities that are historically underserved. We recently developed a needs assessment toolkit to assist state SNAP agencies together with their implementing agencies and other organizations to develop and conduct needs assessments that will best work for their needs. This needs assessment toolkit is currently in the clearance process and will be available in the SNAP-Ed Connection website when it's released. State SNAP agencies should take a lead role in convening the needs assessment process. As FNS primary grantee for SNAP-Ed, state SNAP agencies are ultimately responsible for program administration and operations. The needs assessment process, however, is a collaborative multi-agency effort carried out at the state and local levels using qualitative and quantitative methods. The state SNAP agencies is well positioned to coordinate and collaborate with other state agencies, such as departments of health, education, and agriculture, for instance, and align with the state's nutrition and health promotion goals and strategies. FNS developed the needs assessment toolkit with accompanying webinars and future trainings with the goal of helping state agencies meet program requirements and enhance their existing needs assessment capabilities, with suggestions on how to, for instance, to increase the diversity of voices throughout the needs assessment process and link needs assessment findings to state goals and SNAP-Ed program planning. We understand that applying for and receiving SNAP-Ed funding is challenging for some organizations. Therefore, it is critical for organizations interested in receiving SNAP-Ed funding or partnering with SNAP-Ed programs to work with your state SNAP agencies. Each state agency's SNAP-Ed program contact is listed in the SNAP-Ed Connection website, and these references are provided here. It is so important that our efforts serve everyone fairly and equitably. And thank you for inviting me.
So Doris, I think you teed me up very well. I was asked to talk about partnerships in SNAP-Ed with a special consideration of how those partnerships are taking an equity stance. And also I was asked to mention our partnership with a tribal college in Michigan. So Michigan Fitness Foundation is a state implementing agency. And while we provide technical assistance, evaluation services, and monitoring statewide, our focus and our dollars are directed toward local partnerships. Communities and organizations statewide are invited to submit either a proposal or an application to engage in SNAP-Ed through MFF as a state implementing agency. So what we have tried to do this year is something that I wanted to bring to everyone's attention. We've been engaged in an equitable evaluation initiative nationally through that works with primarily foundations right now. And we began to learn about a new foundation practice of interviewing, panel interviews for proposals and grantees prior to their award, where community members must be part of the panel during the panel conversation. So new this year in our call for proposals, we have funded, well, the call for proposals went out last year, but funding for FY23, we are funding organizations that submitted a brief proposal, but were also chosen based on a panel conversation that included community. And wow, it was really amazing to add the dimension of community voice. I think I actually saw some folks pop up in the participant chat who actually served as external reviewers for that process. And I would mention that our state agency was one of the set in on the review process as well. So partnerships begin with relationships. They can be funded or not funded. But overall, that's really what SNAP-Ed is about and how we move our work forward. SNAP partnerships can be federal and state. We work with GusNIP programs, fresh fruit and vegetable program, team nutrition, school wellness programs. Regionally, we've actually had a partnership with Minnesota SNAP-Ed, where we were working to establish an evidence base for the 13 Moons curriculum. That work was interrupted by COVID, but we hope to get back to that. Story Walk Library Project, which is involving several SNAP-Ed programs across the country to look for an evidence base for that type of setting. Locally, we fund 50 organizations, healthcare foundations, farmers market initiatives, YMCAs, Boys and Girls Clubs, all looking at ST7 and ST8. And I know, Doris, that you're going to, not Doris, Sue, that you'll be getting at a little bit of these evaluation framework pieces. But we're considering equity in all aspects of SNAP-Ed, especially with our partnership work. The community is the expert in what they need and how to define success. They own their data, not us, and they are the ultimate consumer of the data, and they define what success looks like. And although we have fabulous guides and technical assistance coming through FNS, ultimately, if SNAP-Ed is to reach local communities, we need to keep these equity practices in mind. Starting with, at some level, you think about, is a reimbursement grant itself even equitable? And we've been exploring some relationships and partnerships with local communities so that the reimbursement grant process does not preclude participation in SNAP Ed. And one example I have of that is one is with Detroit Community Schools. We actually worked with the Detroit Community School Foundation to serve as the fiduciary for Detroit Community Schools because they couldn't manage through their finances a reimbursement grant process. And the same thing happened with Flint Community Schools, where we found a fiduciary to move programming through, and they eventually became partners in the programming, and that's the Crim Fitness Foundation. We also work with, there are 12 Indian tribal organizations in Michigan and the Intertribal Council of Michigan. We work with both the Bays Mills Chippewa Indian Community and Bays Mills Community College, as well as American Indian Health and Family Services, which is based in Detroit and is a service organization for tribal members from across the state. They have native healers, and they we're interested in participating in SNAP Ed and are one of our partners in SNAP Ed. So, we work to expand their bandwidth, but it's so critically important to begin to allow them to conduct independent interventions to meet community needs. We want to walk alongside and provide support, but as soon as someone is ready to break free, we would want to honor that. They can become a subrecipient where they have any more independence, but ultimately, and because I got a sneak peek at the slides, I think some of the suggestions that Erin's going to make would be something that we would be really excited to see happen in terms of sovereign nations being able to lead SNAP and SNAP Ed on their own. So I think with that, I'm going to turn it over to you, Erin, to talk a little bit and continue that conversation.
Thank you so much, Marcy. I really appreciate that. You teed it up perfectly, and I loved what you had to say about communities knowing what they need and honoring that from an equity lens. And I think that's absolutely in line with what I'm going to talk about in terms of policy barriers for tribes when it comes to SNAP Ed and some of the solutions that we see are possible out there with some legislative and regulatory changes, how we can make some of those things happen. Because tribal nations have been taking care of the health of their people for thousands and thousands of years on this continent, and so recognizing that and honoring that in legislation is really important as well. So thank you so much for sharing that. I appreciate it. I am Mary Parker. I'm the director of the Indigenous Food and Agriculture Initiative. And I will, if we go to the next slide, I'll give you a little bit of an intro about IFAI, and then we'll jump into some of the tribal policy barriers when it comes to SNAP Ed and some possible solutions as well. So IFAI, just briefly, we have been around since 2013, and we've been a free resource for 574 plus federally recognized tribal governments, 100 plus state recognized governments, and over 80,000 native farmers, ranchers, fishers, food producers all across Indian country in the space of food and agriculture. We provide legal research, policy analysis, and educational opportunities and training in the space of food and ag. And we really work across food systems. As you can imagine, that work could be quite broad. And so just a few of our projects are listed here in this slide. Probably most relevant to what we're going to be discussing today is our work as the research partner to an organization called the Native Farm Bill Coalition, and more on that here in a couple of slides. If you want to go to the next one, we will start talking a little bit about tribal SNAP Ed and some of the policy barriers that we know are out there for tribal nations. So first of all, as Marcy teed up so perfectly for me, although there are certainly tribal citizens who participate in SNAP, we know, for example, back in 2020, even before the onset of the COVID-19 pandemic, 25% of all American Indian and Alaska Native people in the United States today rely on SNAP every single month. So this is a significant program for Indigenous people in this country. However, as Marcy mentioned, SNAP administration is currently limited to state agencies. That's not something that tribes are able to legally administer. And that means for SNAP-Ed, it's the same situation, only state agencies are allowed to do that. There are other food assistance contexts like the food distribution program on Indian reservations, or FDIPR, or CMODS, if you're familiar with that from Indian country. That particular program, which is seen as kind of a sister program to SNAP, that's the way it was set up back in 1973 when it first came into being in the 73 Farm Bill. You didn't know you were going to get a fun Jeopardy history lesson for the Farm Bill today, but I hope you're excited about it as I am. I'm a huge nerd, so there we go. But back in 1973, that's how FDIPR was created, as kind of a sister program to SNAP. They're supposed to be alternatives to each other. Tribes are legally able to administer that program, but even though SNAP is seen as an alternative program, tribes are statutorily prohibited from operating SNAP or SNAP-Ed. Those are just limited to state agencies, even though there's this kind of regulatory peculiarity for FDIPR, where an Indian tribal organization, the orgs that Marcy was talking about, ITOs, they are considered state agencies essentially for the purposes of administering FDIPR, but that language doesn't carry over to SNAP. And that language does come back, the root of the problem is a statutory issue. It's from the authorizing language, and that is in a Farm Bill. So it would need congressional action to change that. Another barrier that's very related to this, tribes are really only currently able to participate in SNAP-Ed as implementing agencies. And it's encouraging to hear Marcy talk about the work that she's doing with the 12 tribes in Michigan, and some of those tribes being implementing, or I know there are other tribes that are implementing agencies around the country. I think there's about 12 tribes nationwide out of 574 that are currently participating with state agencies in SNAP-Ed as implementing agencies. But if you think about it, 12 out of 574 it isn't a whole lot. Even though not every single tribe necessarily might want to offer SNAP-Ed, it's still, it's a fraction of the percent of sovereign tribal nations that could be running this program if this policy barrier didn't exist. And I think, as Marcy called out so beautifully, tribal nations understand their community's needs the best, understand the culturally relevant ways that they can deliver nutrition education programming the best, can incorporate not only culturally appropriate or traditional food, but also language as a language preservation and revitalization tool alongside that, because so much of that is tied to food. Food and culture go hand in hand, and having tribes be able to be more than implementing agencies, but full administrators of this program would be a really robust and powerful way to maintain an equity focus, and honestly really lift up and carry forward some of the recommendations that Doris was talking about from the White House National Strategy that was released last week alongside the National Conference on Hunger, Health, and Nutrition. So this is a barrier, but I think there are some solutions as well. And tribal leaders have called out before that what this essentially does, this framework really subjugates tribal sovereignty to states. And since tribal nations are sovereign nations and do have that inherent legal authority to care for the health, safety, and welfare of their citizens on their lands, which is a function they've been performing as governments from time immemorial, really making a legislative change here would just be putting them back in that position that they've always held. It wouldn't be like allowing or enabling anything. It's just recognizing that historical position of sovereignty. And I know Doris mentioned a little bit as well the required consultation with tribes on SNAP-Ed plans. Great to hear. I know the movement at FNS and the recent memo and trainings that they're doing with states on a little bit better implementation of that consultation requirement with tribes. Unfortunately, over the last 20 or so years, I think a lot of tribal leaders and ITO managers across Indian country have been a little disappointed sometimes with states because those consultations haven't always been happening. Those conversations that are so critical to making sure that tribal citizens are not left behind when it comes to SNAP-Ed programming, considering that tribes aren't able to administer the program. When those conversations don't happen, people are underserved. And so tribal administration of SNAP-Ed would really solve that. So if we want to go to the next slide, we can start talking about how we address some of these policy barriers. And I've definitely alluded to it already, but that is the Farm Bill. The Farm Bill is the authorizing legislation, as many of us probably already know, for SNAP and SNAP-Ed. So a lot of the largest, this is the largest piece of federal legislation that shapes food and agricultural policy in the US, and certainly includes SNAP in a very big way. They're intended to be passed every 5 years. The last time we got one was in 2018, and we should, if Congress decides to do things on time, get one next year in 2023. There's always the possibility that we get a CR and go into 2024, but by and large, we're hoping, I think, that we get a farm bill next year, and this would be the next opportunity really significantly to address some of the tribal policy barriers that are present currently in SNAP and SNAP-Ed. We go to the next slide, we'll talk a little bit about how some of that might be led here in Indian country. We would be talking about the Native Farm Bill Coalition and the work of the Native Farm Bill Coalition over the last several years. The coalition is the first time that Indian country has really come together in a big way to speak with one voice about federal policy opportunities in the Farm Bill for Indian country. And the coalition, of which IFAI is the research partner, was founded in 2017 in the run-up to the 2018 Farm Bill by the Shakopee, Mdewakanton, and Sioux community, the National Congress of American Indians, the Intertribal Agriculture Council, and IFAI as the research partner. And we look across the entire Farm Bill to see what opportunities are in all 12 titles of the Farm Bill for Indian country. But really, a lot of the gains that we saw in 2018 came in the nutrition title. None of them were tied to SNAP, unfortunately, although there were certainly some legislative asks from the coalition for SNAP. But ultimately, the coalition's work was really successful. There were 63 tribal-specific provisions that were included in the 2018 Farm Bill that came out of the coalition's leadership alongside over 170 tribal nations. And so it was a really significant effort. And I think we're gearing back up for Farm Bill 2023. If you want to go to the next slide. We're gearing back up for Farm Bill 2023 to talk about policy priorities. There are now over 270 member tribal nations in the Native Farm Bill Coalition, and we have recently released a report that I've got here on the next slide. We don't have to go to that one yet, we can stay here. That talks about a lot of different opportunities across all 12 titles, but most relevant for us in this discussion are the priorities in the nutrition title specific to SNAP. One of the coalition's first priorities is tribal eligibility to administer SNAP, making that legislative change that would precipitate all of these other changes that would affect SNAP-Ed. As I said, there's so many tribal people that rely on SNAP every month, and yet tribes don't have equal opportunity to states to operate this critical food security program and SNAP-Ed along with it. So making that legislative change just right off the top and enabling that tribal administration would go a very long way to addressing some of these barriers. The second is tribal eligibility for SNAP-Ed funding, making sure that tribes not only are eligible for a program, but also have the ability to legally access the funds that help make states and their partners successful in delivering SNAP-Ed is really important. And again, this is essentially subrogation. This is returning tribes to the position they've always had historically, taking care of their citizens, making sure their nutrition security and that their nutrition education is where it needs to be. Those are things that tribes can do better than anybody else because they know their people the best. There's also 638 authority for SNAP. If you're not aware what 638 authority is, we don't have to go into the whole crash course, but just very, very briefly, 638 authority is a legal tool that started in the 1970s that enables tribal governments to take over certain performances, services, functions, programs of federal programming using federal dollars, but then deliver them in a way that makes a little bit more sense for the tribal community. It offers a lot more flexibility and is a really strong recognition of tribal sovereignty. That had never applied to USDA until the 2018 Farm Bill, and it now applies in a very limited context to FDIPR. But the coalition had pushed in 2018 and has identified as another priority for 2023 that tribal 638 authority for SNAP would also go a long way to addressing a lot of these barriers as well. And along with that, not only does it improve service, but 638 historically has also improved programmatic costs and even produces cost savings, because as I think anybody who works in Indian country knows, nobody knows how to stretch a dollar like a tribal leader, and that could absolutely produce cost savings as well here in the SNAP arena. We go to the next slide. Just got a little bit of a promo for for our Gaining Ground report. If you are interested in learning more about these and 150 other additional policy opportunities for Indian country in the 2023 Farm Bill, you can definitely check out our recent report. You can go to nativefarmbill.com to download it and read. Give yourself plenty of time. It's about 140 pages long because it does go over 12 titles of the Farm Bill. But if you're just looking at SNAP and SNAP Ed, I would focus on Title 4, of course, the nutrition title. And if you go to the next slide, I think I've got my contact info, and then I will pass it over to Sue. Thanks, everybody.
Thank you, everybody. This has been an amazing bolus of information to stimulate our thinking. My job is to talk a little bit about the opportunities and sort of operationalizing collaboration. And my background does come from California, where we had a nutrition network that funded over 100 different organizations, including nonprofits, as well as school districts and health departments and some tribal groups. So that is my background from earlier in the program. Today, I'm going to focus a little bit more on the focus on coordination and collaboration that has become so important in SNAP Ed. As Doris mentioned, the needs assessment that is going to be required should include asset-based considerations. So who are the potential partners in your catchment area that want to achieve similar goals? What are their priorities and how can you work together? As Marcy said, a focus of SNAP Ed is heavily on disparities, and to fund more organizations, one of the things that wasn't said is that the funding for SNAP Ed has been stable, except for cost of living increases since 2009. And so the state implementing agencies, which is what we call the organizations that receive direct funding from the state SNAP agency, have increased over 160%. That is, when the funding formula changed after the 2010 Healthy Hungry Kids Free Act, it went from about 100 implementing agencies now to nearly 170. So, and yet the funding remained pretty stable. So in terms of what I'm going to talk about, next slide, please. I'm going to be drawing heavily on the current events that Doris talked about, the USDA policy background for coordination and collaboration, which is long and deep, and then tools for thinking about implementing collaborative action. It's easy to talk about, and it has been talked about, but it's really very difficult to do. And I'll be drawing especially from a coordination guide that my organization, the Association of SNAP Nutrition Education Administrators, which we call ASNA, I'll be drawing heavily from a coordination guide that group is developing with the idea of equitable partnerships and collaboration. Next slide, please. So as Doris laid out, the time for collaboration is really now. There has never in my career been the level of opportunity that it was created by the White House Conference. Next slide. I was around at the end of the 1969 conference and know what that resulted in, but this one is much bigger and appropriately so. So just looking at the time frames, if you can look on the right side of the screen, you'll see that before the White House Conference, the USDA had established 4 pillars related to nutrition security, which of course is both having enough food and having the right kinds of food. And these were the priorities that were identified back in March. Then with the national call to action of the White House Conference, the reasons were these basically population statistics that have been accumulating for a very long time, but were put together in a very meaningful policy format. So you can see that these are statistics that were quoted at the White House conference, and they're really quite dramatic, and they pull in so many different sectors of society in really the cost of poor nutrition and physical inactivity. Next slide, please. So if we look at the 5 pillars that the White House conference put forward, you'll see that they are comprehensive. So it's increasing food access throughout the life cycle for all people, and particularly for those in underserved communities, integrating with healthcare, which has to do with screening, referrals, and other kinds of nutrition support, empowering consumers, which includes community support. So not just people knowing what they should eat, but also being able to make it easy and accessible, supporting physical activity, and then enhancing relevant research to support the delivery of programs. What was extremely exciting, and I urge you to keep track of this, is that there were over $8 billion of in-kind pledged by organizations to help support the goal. And I think everyone knows that the goals of the 2022 White House conference were to end hunger, to improve diet, to improve physical activity, and to reduce chronic diseases by 2030. So basically, we have 7 years, and very hard target. And so I think it was really important that that goal be established, which then generated over 150 organizations with household names that you recognize coming forward to help, with a focus on underserved communities and people that have been left behind. So that is what is really exciting right now. And I'll talk a little bit about that. But just to let you know that those commitments are on the CDC Foundation website, and the CDC Foundation, which is statutorily established to support CDC-related activities, is going to be working with those pledges, and hopefully will be a place that we can work, that we in the field can work to connect with those resources. On the same side, I'd be interested in knowing from Doris what the plans are at USDA for USDA to work with its programs on connecting the commitments. So moving on, the other report that you should know about is one that came out before the White House conference, which talks about really a master's level summary of what resources, what coordination efforts are going on throughout the federal government. I think there are 25 agencies, so HUD and HHS, Department of Interior, and so forth, are all named there, Department of Defense. Next slide, please. So the second area, just very quickly, is kind of a policy history of coordination and collaboration at USDA. Next slide. So this started in my career in the 1990s when USDA reviewed all the research and decided and concluded that multi-sector approaches were needed if dietary change was to improve in this country. There have been several GAO reports, Government Accountability Office. Congress has had similar recommendations that, not recommendations, but statutes that it has passed over time, most notably for SNAP-Ed, the Child Nutrition Reauthorization known as Healthy Hunger-Free Kids Act in 2010, and then more recently, the 2018 Farm Bill that was discussed a little bit earlier. And then in 2016, FNS adopted the multi-level SNAP-Ed evaluation framework, which I'll talk about in a moment. And then last, which is very exciting, is that FNS will be phasing in electronic reporting in SNAP-Ed, which is going to be the first ever effort to try to track results on such a large scale in a federal nutrition program. So I think everybody knows that SNAP-Ed uses mixed methods. This was clearly established in the 2010 Child Nutrition Reauthorization for SNAP-Ed. This in the last couple of years, state nutrition action councils, committees, or coalitions have been emphasized by food nutrition, the Food Nutrition Service. And as Doris mentioned, over 30,000 partner organizations are already working with SNAP-Ed. So there's a strong infrastructure that potentially can really kind of move the needle toward those 2030 objectives. Next slide. So here is the SNAP-Ed evaluation framework. I'm going to assume that most people are familiar with it, but what it does is systematically lay out a range of outcomes that would be critical for moving the needle toward healthy eating, physical activity, food security, and chronic disease prevention in the real world. And so these objectives or indicators or outcomes were identified by the field in partnership with Food Nutrition Service. And each of them contains results that would be critical for lower income communities. And I'll talk about that in a little bit, but I'm hoping that most people are familiar with the evaluation framework and know that it was created in 2016 and is due for an update because of so many changes that have occurred in our field since that time. The 2018 Farm Bill being only one, the White House Conference being another. Next slide, please. So the third way that I want to talk about, or to really get at coalitions and collaboratives, comes from the coordination guide that ASNA is developing now. Next slide. So we can think about coordination and collaboration from a kind of a systematic scientific perspective using the social ecological model that was already mentioned. But if you look at this slide, which you'll recognize from the Dietary Guidelines for Americans, you'll see that systematically the factors that contribute to healthy eating and physical activity among individuals in the organizations that they are part of or that they participate in whole communities, the different sectors that deal with food and activity and health are mentioned. And finally, the broad area of social and cultural norms and values are all considered in a systematic way. And if you work with SNAP-Ed, you'll recognize that all of these are theory-based, that in each of these spheres of influence, individual, environment, and so forth, the ideas for the approaches that are used for change are intended to be based on scientific evidence. And so you apply different theories of change in each sphere independently. Next slide. So a simple concept that is used in many fields is the idea that cooperation and collaboration grow from being simple exchange of information all the way to actual collaboration where people are working together, sharing resources, and redirecting their efforts accordingly. So this ladder of collaboration was operationalized by the Public Health Institute in a guide to state nutrition action councils that you can find on SNAP-Ed Connections. But what you can see, if you can turn this slide upside down, you'll see that there's a stepwise approach to increasing levels of working together. And so networking is just what you do all the time, keeping up with each other and knowing who's doing what. But then coordinating is when you start to work a little more deeply and think about how your work together or with others can complement each other. How could it make more impact than either of you alone? Cooperating then means that there's much more of a shared effort. And you can see some of the steps in cooperation that grow from simple coordination. And then last is collaboration. And that's really the highest level of working together that coalitions and collaboratives aim for. And so generally speaking, the higher up you go in this virtual ladder of collaboration, the more effective and the more impact you're going to be having. You'll also be changing because you'll be listening to one another, you'll be learning, and you'll be adapting in order to take advantage of new opportunities, as well as to deal with difficulties that you've established and to sort of regroup and reconnoiter. Next slide. And last but not least, here is a simple approach to thinking through higher level kinds of collaboratives. If you're familiar with collective action, this is something that Stanford Center for Social Innovation has identified among collaboratives of all different disciplines as the factors that can help collaboratives actually work together over time and achieve results. So I don't think you can read this, but if you Google collective impact, you'll see quite a lot of work on this topic. But it basically starts with having a common agenda. What do all of you agree that you want to accomplish? To continue to communicate about what you're doing in this area, what your challenges are, what's coming down the pike, really to share and to trust. It's not a competitive process. And then to have shared measurement, that is, what are the targets that you agree that you want to be reaching? And in that regard, what are the measures that you're going to be sharing as to what your progress is? And finally, having a backbone function, that is, those members of the collaborative that can help monitor and keep track and keep people informed to provide these different functions. So this is something that if you look at your own work, you may be able to think through what might be missing or what you might be adding in order to increase your impact. Next slide, please. So in conclusion, what you'll see here is that the SNAP-Ed evaluation framework provides a kind of quick study on what kinds of outcomes can be secured through cooperative activity, collaborative activity, that would make the big difference toward meeting those 2030 objectives. As I mentioned, each of these outcomes, and there are 51, build on each other. They're complementary, and they are designed to start with planning, to go through to implementation, and then to be long-term or sustainable, hopefully permanent. And that's what we're trying to achieve in this program. So one of the areas that you start with is on the readiness and capacity side, with understanding what it is that your partner organizations want to see, what the resources are that they can contribute, and what you can do together. Moving forward then, all of these, it's systematically to surround members of the public with the support that they need to be successful in permanent lifestyle change for eating and exercise. And together that contributes to population results, whether it's a segment of the population or whether it's an entire, maybe an age group or an ethnic group or an income group or a geographic group. It can be any level of population. And together this looks at the measures that are in the framework are intended to help you see how the particular topic that you're working on is progressing. I will say that we developed the measures back in 2015, 2016. So the field has moved along and some of the priorities may have changed. So we are interested in looking at measures that might be more up to date with the changes that we're all experiencing and the excitement that we have for the future. Next slide, please. So with that, I'd like to thank you for the opportunity to talk with you about coalitions and collaborations. And if you have any questions, I will put some of these resources in the slides that you'll get or the materials that you'll get next week, but you're certainly invited to contact me at any time. So with that, I'll turn it over to Kalia for questions and answers.
All right, Sue, thank you. So we can go ahead and let's take down the slides for a moment so that we can see all of our presenters very clearly on one screen. And let's get into our question and answer discussion portion. And we've got a couple of questions here in the Q&A box. Actually, the two that we have in here, I think, are very related to one another. And I see that Marcy started to respond to one, and that's where we're going to start. So for all of our panelists, and then maybe Marcy, you can start us off with this. How can we improve the accountability of SNAP-Ed to the communities that we serve? Specifically thinking of mission drift through many small decisions by administrative decisions that come from fear of new things and lack of structural support and understanding of how equity looks in practice. But the communities do provide great feedback if the power structures are aligned to utilize collaboration in this way. So Marcy, let's start off with you.
And we've been just thinking a lot about that term accountability and where should the power live when you're working with community, and what is your role? There's a reciprocal accountability that when and I'm feeling like I'm guessing, Doris, that you feel this too. There's a reciprocal accountability, hence building out our ability to support increasing the bandwidth at the local level so that communities can define for themselves what is success, what does this mean in my community, and how do I come to know that what we're doing is making a difference. And it's such an important orthodoxy that we need to break out of when you say, that we're accountable. What are we accountable for? I'm just accountable to the public trust. But beyond that, I'm also accountable to individually to the communities that we are supporting, that I am in service to. So kind of that, to get that started, yeah.
Other
Well, and
thoughts from
I'll
our
say
panel?
as well that there's been interest in developing dashboards that reflect progress toward change. SNAP-Ed is great because it's a permanent program. It doesn't have a 2-year or 3-year grant window within which you have to make change. And so having a dashboard that, so far, a number of states have created dashboards. And so partners, both funded and unfunded, can definitely be part of that dashboard and carrying the dashboard forward within state or local venues, and with partners or potential partners to try to see where changes can be made.
I would add to that. I think from our perspective working with tribal nations, when we're talking about success for SNAP-Ed or really any program, to the extent possible within the many regulations that you have to follow, which we know sometimes pose additional barriers, let the community define what success means in your programming. Like tribal nations and tribal citizens are 100% able to self-define what good nutrition education programming looks like, what health outcomes should be coming from that, and what those should look like. So I would really, encourage you and that I think not just for a tribal context, but for so many underserved and marginalized communities, you're talking about people who have thousands and thousands of years of understanding of what these things are before colonization disrupted their foodways. So, you know, returning to that place of community defined success is really important. And I would also say, have conversations. I know we talked a little bit about the SNAP consultation. I know FNS I got the memo that Doris mentioned and is doing some trainings with states again on what that means in practice. And I know that, you know, there are some states who understand that they haven't always been the best partner to tribal communities, and I think are now wondering how they repair a relationship, and maybe are reaching out to tribes and not getting a lot of response because of that historical bad relationship. You have to keep trying. Like, you have to be self-accountable as well. And you have to understand, I think, you know, you may have to fail a couple of times in your outreach before you get a good contact, because you are repairing a relationship. You are fixing trust that's been broken. So having that internal understanding as well, and not pushing that feeling that you get from that back on your tribal partner is going to be pretty important too.
Yeah, and I just want to add to this great conversation about you know, sharing results and being accountable. And as many of you know, we're currently developing a online data reporting and system, and we are also looking into how the data that we will be collecting will be visualized. And we have done extensive enhancements and upgrades to our SNAP-Ed Connection website. And the new and refreshed website will roll out in a little while. When it comes out, you know, there will be, you know, we won't have the NPAIRS data yet, but we will certainly be working on where to allocate that data. There will be, we hope to have things like dashboards and maps to show at the state pages, to show the accomplishments at every state. So those are things that are coming, and we're working hard on those. And also our new system will be, as I mentioned, we'll be collecting more extensive and comprehensive needs assessment information. So it's really weighing burden on our grantees to provide this information, and being able to use that information to show the program's accomplishment and to help the states plan their programs to be equitable. So all those things are just intertwined. And we look forward to being able to share that information when they're available.
So I want to come around to something that Marcy brought up in her presentation about equitable evaluation in just a moment. But first, because it's very related to the topic that we're on right now, our other question in the chat box: is there any plan for USDA, as well as the state agencies, nonprofits, and other organizations administering and implementing SNAP-Ed, to develop a public statement of apology for their role in history in actually creating the food apartheid that they are now purporting to try to resolve? Seems like a good place to start. And just quick comment to everyone, you know, when we're talking about food apartheid, you know, as opposed to, say, you know, terms that have been more traditionally used, food desert, it is to say that there were intentional systems in place that created these circumstances that we find ourselves in terms of lack of food access and equity, where things of that nature is concerned. And certainly part of that conversation is systemic racism. So, and even considering that USDA has established the Equity Commission here recently, Subcommittee on Agriculture, and as was mentioned at the beginning of these presentations, that kind of this time that we are in, where there's so much opportunity to address these things, because it is a very relevant, just out there part of the conversation now. What are some of these steps that are being taken to, as Aaron said, kind of repair relationships and recognize the systems that came out of some of the historical, I guess, goals, you would call it, that still exist today?
It seems that first and foremost, having conversations and acknowledging and recognizing that it happened, and what our partners, our local partners, are telling us is that these are conversations that come up in food policy council meetings. And Colia, that's something that you're, the Center for Regional Food Systems is very active in supporting the local food policy councils, and actually having that conversation. Which, as we come back to being in person, sometimes these are easier to have than they are when they're on Zoom. I find there's some things that are, difficult conversations are hard to have sometimes on Zoom, especially when you're being recorded. But the local food policy councils, I know I heard a story of a council having a conversation about, being 2 blocks away from an interstate highway that was built in the 60s that divided and destroyed a community that now on one side of that highway is a food desert, experiences food apartheid, and on the other side has access to all kinds of different services. So just calling that out, I think, is an important, and having that conversation and recognizing that happened. And so that's a start in my thought.
Yeah, I would say, not only did that happen, it still happens in a lot of places
Right.
in Indian country. I mean, redlining is definitely still a thing that tribal communities experience, especially when we're talking about credit access in an agricultural context, finding lenders who understand and want to work with the complexities of the landholding system created by federal policies like the General Allotment Act, which, even though it ended in the 30s, continues to impact tribes today. I mean, those things are still ongoing. I would say, from my perspective, I think apologies are a great place to start, but apologies without action, that's a little hard. I think, if an agency, and I don't ever expect a federal agency to issue an apology, because I'm an attorney and I understand that means that you're taking on liability for the federal government. And so, like, you're not going to do it. So we don't usually ask federal people to apologize because we just don't expect you to do it. But I think what tribes do expect is action. And there's like that federal consultation process that can lead to that action. I think some of the work that I've done in the FDIPR context moves beyond, like an apology into actual discernible results, where we're getting traditional food in the hands of tribal citizens that's actually native produced food. So it's improving economies at the same time, where federal partners can work and listen and relax the regulatory burden or barriers that they do have authority to change. That plus an apology is even better than just saying I'm sorry. So.
Well, and this is a little bit tangential, but if people don't know, the SNAP-Ed calendar year is based around having a plan and then an annual report as to how the plan went. And so when the planning stage starts, hopefully many people will be at the table, and you can take a look at what the objectives are that rise to the top. What are the priorities? And along with that, what are the assets that will enable you to get results within a reasonable period of time? And so the planning process is becoming more transparent. In some states, it's very, very transparent. In other states, possibly not as much. But this is an area where you can contact your state implementing agencies. And some states have many, other states have only one. So if there are many, there may be some who have an affinity to your area of interest, whereas others are sort of more comprehensive. But I would urge you to find out who your state implementing agencies are and get involved with that planning process. In the planning process, you can select the priorities that you want to address, whether it's food deserts or whether it's a healthcare type of a priority, or it's access to any of the nutrition assistance programs. All of those with SNAP-Ed, it's flexible. The framework allows you to sort of do a 360-degree look at the needs as defined by people in the state. and by the people that are going to be impacted. So I would urge you, if you haven't been involved, to check into those with those state implementing agencies and or the state agency itself, the SNAP agency, to get involved and pick the priorities.
And I'll also note here in the chat box, Doris dropped a resource to the USDA commitment to the White House conference. And I know that there's about 44 pages in that, but, as Erin was talking about action, Doris, maybe you can talk a little bit about what's in that report and that idea of, even getting beyond apology, which I understand there's some legalistic barriers there, but getting to the action part. Oh, Doris, you're on mute.
I actually happen to have that document open and I need to scroll a little bit, but some of the, okay, for instance, let me start from the top. I'll just name a few examples that's relevant to this conversation. For instance, bringing SNAP and WIC shopping online. That would address some of the food desert issues. Not all, that for sure, but that might address some of the food desert issues that we all have been concerned about. And then also in pillar number 1, which is associated with improving food access and affordability, there's also one on the FDPIR program, and that is expanding access to FDPIR and aligning food with traditional tribal foodways. I think that is one action that's trying to reconcile the fact that tribal members, as well as anybody else, really need to have healthy food. And in the past, that was not always the case when it comes to the food package and FDPIR, but we know it has been improving in the recent years. And then other pillars, as I talked about, related to SNAP-Ed, the refresh and the enhancements in the SNAP-Ed connection website is really going to truly provide more information and access to people who are working with SNAP-Ed and providing them with easy access to information. We also have in here related to SNAP-Ed, what I talked about in the beginning about restructuring of our SNAP-Ed program in the national office so that we can increase our capacity to innovate and to collaborate with more partners from all levels, and to provide training and technical assistance where it's needed. In the past, we basically had 2 staff members in the national office, as you know, with a manager that also took on other programs in her portfolio. Now we have a dedicated branch for SNAP-Ed, and our capacity had tripled. So we really expect to have the opportunity, once everybody get their footing, to really do a lot more when it comes to collaborations.
So I'm going to kind of go in a very big circle to get to equitable evaluation and bring in some of what Marcy talked about with local food councils and some of the experience that I have working in that space, and some of what Sue talked about with collective impact. And I can just share that one of the networks I co-coordinate along with some of my Center for Regional Food Systems colleagues is the Center for the Michigan Local Food Council network. And we have very explicit discussions about power sharing. What does it look like to make sure that we are putting structures in place that allow community voice not just to be heard, but mobilized. And furthermore, that connection to decision makers, influencers, and I never love to use the term seat at the table, because in my mind, sometimes we need to abolish that table and the idea of what that represents altogether, and start anew. But, very explicit discussions around systemic racism, and some of the power dynamics that exist therein. And a lot of this has to do with, community organizing principles as well. So, Sue mentioned collective impact, which looks at common agenda, shared measurement, mutually reinforcing activities, continuous communication, and having backbone infrastructure. And that organization that put that report out has, and learning that has come over watching some of these initiatives take place, which you could certainly put SNAP Ed into that space as well. A collective impact 3.0 model, which goes from, looking at a common agenda to really centering and prioritizing community aspiration, going from shared measurement to having more strategic learning as a part of that shared measurement, going from mutually reinforcing activities to a high leverage and systems focus, really looking at taking risks and leaning into what we specialize at and working with one another from that perspective, going from continuous communication to authentic community engagement, and going from having a backbone infrastructure to creating this container for community change, where communities are very involved in that mobilization and the action. So, when we talk about equitable evaluation, and SNAP Ed equity metrics and the involvement of the community, what does that look like? How do we get there? Even recognition of some of the capacity issues that we have here.
So we're trying to think of it as bandwidth, not capacity, Colia. So
Thanks, Marcy.
Bandwidth.
Yes.
Yeah, part of that equity is beginning to operationalize and understand how you get the data that belongs to the community back to the community. And while I appreciate a statewide background dashboard is important for lots of reasons, I fear that a majority of my partners would say to me, I want to know what's happening right here. That's great, but all those people up north or all those people over to the west or the east, my program is here and what's happening here. So, but I do think that as we go down that road, especially with increased capacity with Doris's team, we can do even better with coming up with individualized dashboards for local communities, so that they can get that lens that they need to keep growing and improving. That would be really important.
Well, and along with that, one of the points that's been made on the White House conference is that the most power comes when you combine data with stories. And so having some strong data, the way that, has finally been pulled together nationally, but on a local level or tribal level, can make a really big difference in persuading some other organization that is concerned but hasn't known how to help, to be able to help. And this is where I think the commitments that have been promised or pledged to the White House conference will be a huge asset. The concern that I have is that a lot of times these pledges don't have any way of connecting with the people or the organizations that could use them. And so that brokering is really, really important. And the communities of interest, such as the people that are here in this room, need to be reaching out and working together, again, not competitively, but collaboratively, and providing data that show where we are now and where we will be in a year, 2 years, 3 years. And so having good metrics, and again, to be responsive to the equity issues that have been talked about on this call, that is something that we do need to build together. What are the measures and indicators that we don't have that need to be lifted up? And then how do we move toward increasing them?
So the stories the mixed method evaluation, the stories being qualitative. You can fill out a 24-hour recall, or you can sit down with someone for 15 minutes and talk about, tell me about your favorite 5 recipes that you tried new things that you ate while we were working together. Or that's not my best example, but but there are ways there are real true research methodologies and evaluation methodologies where we could create a report out of those kinds of things. When you look at a population, and a population increases their fruit and vegetable consumption by 2 tablespoons, that's really significant, right? We know that if a population moves that direction, whereas for an individual, if you know that they say, I've got 5 new 5 new kale recipes that now I love and I'm going to serve regularly to my family, you can be pretty assured that that's more than 2 tablespoons, right? So really thinking a little bit much more broadly about evaluation and how we tell that story and how we let the communities tell that story.
Mm-hmm. Yeah. And I know we are getting short on time here, but as someone who has utilized public benefits, public assistance, utilized SNAP in my life, I've often thought about the connotation around saying entitlement program, and what does it look like to shift to thinking about this as an empowerment program to really go beyond even and I shouldn't say just the way that we eat in our lives, because as Erin was saying, these are cultural tools. They're so much more powerful than that. And what does it look like to lean more into that with SNAP and SNAP Ed? And we are going to explore that further in this series. So if we could very quickly get the slides back up, I'm going to take the last couple of minutes to transition us. And one thing we'd ask you guys to do, all of you in the audience, is to just take 5 minutes to, less than 5 minutes even, to answer this short survey on your way out. We've put the link in the chat box for you to access. And next slide, please. And then all of our speakers' contact information. I am going to grab that real quick and put in the chat box for all of you as well, so you have direct access. And I just want to take a moment to thank our guest panelists for their time today, and a conversation that we only were able to just start here in this 90-minute period. And in our last 2 minutes, ask each of you if you have some final parting thoughts. Don't be shy, feel free to jump in.
I'll start. I want to thank you for inviting me, and I really appreciate listening to this conversation and seeing some of the questions in the chat. It's always important food for thought in our work. Thank you.
Mm-hmm.
We're all partners in this work, and all of the things we talked about apply to our relationships with each other, as well as the relationships we have with the people that we're working with in our states. And so I appreciate the conversation and everyone's growing together in this work.
Yeah, I also appreciate everybody joining this afternoon, and thanks to Kalia for running the show here and inviting all of us. This has been really great to chat with everyone. I would say if folks are interested in working more with tribes, or if you're with a state and you want to talk a little bit more about consultation and maybe some best practices for tribal consultation and work with tribes, we'd be happy to chat about that. Reach out anytime. IFAI is actually working on a better guide to best practices in consultation right now, and we're hoping to have that report out next year. So hopefully that'll be a good resource for you in the future as well.
And I'll just wind up by saying, also thanking the planners for this opportunity, and inviting anyone who's on the line, if you have recommendations for updating the evaluation framework with the kinds of metrics that matter to your communities and matter in your world of work, please know that ASNA is working on that, and we would very much appreciate your suggestions. SNAP Ed is the biggest of USDA nutrition education and promotion programs, but it's even at that, the funding has not been enough to expand the program to reach the many organizations that could do an amazing job if they had a little bit of spending money. And so one of the ways we do that is by talking about things that matter. And so in terms of measures and metrics, please know that if you've got suggestions for how the framework can be better, please pass them on.
So just final reminder to all of you, we will follow up with the recording and the slides next week, and look out for the announcement for the second webinar in our SNAP Ed series that will focus on community food access, nutrition security, and culturally appropriate education. So again, thank you to all of our panelists and to all of you out in the audience. Take care, and we'll see you next time.